For more anatomy related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we will continue the anatomy of pharynx. So today's main topic of discussion is the Waldeyer's lymphatic ring. So what is the Waldeyer's lymphatic ring? It is cluster of aggregation of the lymphoid tissues around the nasopharyngeal isthmus. So this is the nasopharyngeal isthmus and here is the Waldeyer's ring. So here the lymphoid tissues, these are the lymphoid tissues, they are arranged in the form of a ring. So hence it got the name Waldeyer's ring. So on top of it you can see the nasopharyngeal tonsil. So the nasopharyngeal tonsil we have already discussed in the previous class. It is present in the roof of the nasopharynx. So this undergo inflammation and result in the condition called as the adenoid, which blocks the respiration through the nose. It is usually seen in children and by puberty this tonsils disappear. So that is the nasopharyngeal tonsil. So it is seen in the top portion of the Waldeyer's ring. So below you can see the lingual tonsil. So this is the lingual tonsil which is present at the dorsum of the tongue. And there are a pair of tubal tonsil and also a pair of palatine tonsil. So these are the palatine tonsil and these are the tubal tonsil and they are a pair. And usually we call the palatine tonsils as the tonsils. So it is of more important compared to other tonsils. So today we will discuss more about the palatine tonsils. So now we will discuss the location of each of these tonsils. Posteriorly and above is the nasopharyngeal tonsil. So this is the tonsil which disappears by the puberty, and laterally and above is the tubal tonsil, and laterally and below there is the palatine tonsil, and inferiorly there is the lingual tonsil over the posterior part of the dorsum of the tongue. So over the posterior part of the dorsum of the tongue is the lingual tonsil. So this is the location of the lingual tonsil, and palatine tonsil, it is seen on either side laterally below, and the tubal tonsil, it is seen on either side laterally above, and nasopharyngeal tonsil, it is seen posteriorly and above. So these are the location and these together forms a ring. So now we will discuss about the palatine tonsil. So it is one of the most important tonsils, and the name tonsil, it is usually referred to the palatine tonsil. So it has got two surfaces, that is the medial surface and also lateral surface, and it has got two borders, that is the anterior border and also the posterior border, and it has got two poles, the upper pole and also the lower pole. And this palatine tonsil, it is located between the two arches. So these two arches, that is the palatoglossal arch and the palatopharyngeal arch. Suppose this is the palatoglossal arch, this is the palatopharyngeal arch, the tonsil, it is located in between this. So in between this arch is the location of the palatine tonsil. The medial surface of the tonsil, it is covered by the stratified squamous epithelium which is continuous with the mouth. And the medial surface, it contains 12 to 15 crypts. And the biggest crypt, it is called as the intratonsillar cleft. So this is the intratonsillar cleft. So the medial surface, it has got 12 to 15 crypts, and the largest of it is called as the intratonsillar cleft. And the lateral surface, it is covered by a sheet of fascia which forms a hemicapsule of the tonsil. So the lateral surface, it is covered by a sheet of fascia which forms the hemicapsule of the tonsils. So now we will discuss what all structures are involved in the formation of the bed of tonsil. So this is the tongue and this is the soft palate, and this is the location of the palatine tonsil. Anterior to it there is the palatoglossal arch, and posterior to it there is the palatopharyngeal arch. In between is the palatine tonsil, and this is the bed. So what all structures are involved in the formation of the tonsillar bed? So you can see the pharyngobasilar fascia, superior constrictor muscle, the buccopharyngeal fascia, the pharyngeal venous plexus, and also the glossopharyngeal nerve. So these are the structure which are involved in the formation of the bed of tonsil. That is the pharyngobasilar fascia, superior constrictor muscle, the buccopharyngeal fascia, pharyngeal venous plexus, and also the glossopharyngeal nerve. So now we will discuss the relation of the palatine tonsil. Anteriorly, it is related to the palatoglossal arch. Posteriorly, to the palatopharyngeal arch. Superiorly, there is a soft palate, and inferiorly, there is a tongue. So these are the relation of the tonsils. So now we will discuss about the arterial supply of the tonsil. So the main blood supply to the tonsil, it is a tonsillar branch of the facial artery, and other sources are ascending palatine branch of facial artery, dorsolingual branch of the lingual artery, ascending pharyngeal branch of the external carotid artery, the greater palatine branch of the maxillary artery. So these are the blood supply. So main source, it is the tonsillar branch of the facial artery. Other branches are ascending palatine branch of the facial artery, dorsolingual branch of the lingual artery, ascending pharyngeal branch of external carotid artery. So venous drainage, it is into the palatine, pharyngeal, and also the facial veins. And the nerve supply, it is by the glossopharyngeal and also lesser palatine nerves. So nerve supply, it is from the glossopharyngeal nerve and also the lesser palatine nerve. So today we discussed about the Waldeyer's lymphatic ring. That is, it is a cluster of aggregation of lymphoid tissues, and they are arranged in the form of ring, and it consists of the nasopharyngeal tonsil, the tubal tonsil, the palatine tonsil, and also the lingual tonsil. And we discussed mainly about the palatine tonsil. It is one of the most important tonsils, and we discussed about the tonsillar bed and the blood supply, nerve supply, etc. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.